Hello everyone, welcome to sqadia.com, and in the fourth section of malignant disease of the ovary, we will talk about the sex cord-stromal tumors. These are mainly of three types: granulosa cell tumor, thecomas, and Sertoli latex cell tumor. So sex cord-stromal tumors can be granulosa cell, thecomas or fibromas, and Sertoli latex cell tumor, also known as androblastomas. And then there are gyneandroblastoma, which are the mixed type. Features of all these tumors are present in this, so it's a mixed type. 6 to 10% of all ovarian tumors are sex cord stromal tumors. The peak incidence is usually after 50 years of age. Functioning tumors. Granulosa cell tumors, they are 2% of all neoplasm. They are commonest ovarian stromal tumor. So most common are granulosa cell tumors. Under the microscope, if you see round or polygonal coffee bean nuclei. Here, if you see, they are round coffee bean shaped nuclei are present. So diagnostic feature under the microscope is easy to see. These are round coffee bean shaped nuclei, and these are known as Exner bodies. Exner bodies. Some clinical features of granulosa cell tumors, they are if prior to, depending on what time or what age they are present, if they are prior to puberty, before the puberty occurs, if they are present, that leads to precocious puberty. Precocious means early onset of puberty, usually if they occur before the puberty. If they are during the reproductive age, usually female comes with the uterine bleeding, and they say they have off and on abnormal uterine bleeding. And if after the menopause, post-menopausal, after the reproductive age, usually again mostly the patients complain of the bleeding. Treatment for granulosa cell tumors are laparotomy and surgical staging. So with the laparotomy, abdomen is open, tissues are removed to do the biopsy and staging. And then there is unilateral salpingo-oophorectomy. Unilateral is especially important when there is it's the childbearing age of the female, and they want to have a family, so unilateral salpingo-oophorectomy is preferably done. And then also chemotherapy is done for the treatment. Then thecoma is the other type, and this is usually the common in the post-menopausal age, after the menstruations stop, and it looks usually like a fibroma, like a fibroids. These are the thecomas, and after the menopausal age. Then there is usually endometrial hyperplasia, and it is associated with endometrial carcinoma, and treatment is usually the surgical removal, total hysterectomy with bilateral salpingo-oophorectomy. You can see in this the thecoma, and it's like a fibroid, big, and total removal of the uterus along with the bilateral tubes and ovaries. So bilateral salpingo-oophorectomy. Then Sertoli latex cell tumor, the Third type, it is not very common. Less than 0.5% of the tumors are Sertoli Leydig cell tumor. They are very small, unilateral, solid. They are not cystic, nothing inside. Usually they are yellowish in color with small hemorrhagic or areas of hemorrhage. So yellow with reddish appearance. The resemblance is usually to the testicular cells. Clinical feature in this, mainly there is defeminization or masculinization. So females usually have built like males. They have mustache, beard. So masculinization is common, and there is loss of defeminization. And like any tumor, usually the treatment is surgical treatment and adjuvant therapy with the chemotherapy and radiation therapy is also involved. This is the diagram showing Sertoli cell tumor under the microscope, histological picture with lot of cells and nuclei. You can see lot of growth of the cells. So that was all about the granulosa cell, thecomas and Sertoli Leydig cell tumors. Thank you for watching sqadia.com.